So now we change the flavour again, and we have a symposium on post-thrombotic syndrome. We do have a number of patients here of post-thrombotic syndrome, and we actually laid out some chairs at the back for them so they could put their legs up so they didn't get swelling from sitting for a prolonged period. We're going to start this session with Claire talking about how post-thrombotic syndrome has really affected her life. So I call upon Clare Reynolds to come and tell us all about post-thrombotic syndrome.
Hi, just before I'm about to speak today, I'd just like to present Kim Carter. She's a health visitor professional who won the Stocking-a-thon with an amazing time of 1 minute, 1 second, 0.11. If us patients could get them on that quickly, we wouldn't have a post-thrombotic leg, I don't think. But if you'd like to come up here, and Beverly, if you'd like to present further. My name is Clare Reynolds. I'm 35 years of age, and for just over the past 10 years, I have suffered with post-thrombotic syndrome and VTE. I am here today to talk about PTS from a patient perspective and what it is really like to live with it. Also, how you live with it and have the best life you can. I'm going to keep this extremely brief. I have 10 years of experience to cover and could be here all day. So if anybody does have any questions, please feel free to ask them at the end. I'm going to start with the medical description of post-thrombotic syndrome, which is the complications that may follow DVT, which can include persistent oedema, which is swelling, pain, purpura, which is bleeding into the skin, increased skin pigmentation, eczema-like dermatitis, itchiness, ulceration, and cellulitis, which is a bacterial infection just below the skin, and it's also called post-phlebitic syndrome. This is, in essence, a very accurate list of symptoms that a doctor could use to diagnose PTS. However, it does not cover the impact that this condition can have on a patient's life. From 3 months after my initial DVT, I have suffered the symptoms of post-thrombotic syndrome. However, it wasn't until a year after my first clot, an intervention from my haematologist, I actually got to see a vascular surgeon about it. This was where I finally obtained a formal diagnosis and a proper explanation of what was happening to me. The problem is when you have a fresh DVT, the symptoms are very similar to that post-thrombotic syndrome. In what I like to call the first phase of living with VTE and PTS, you spend many days backwards and forwards to A&E or your GPs with a suspected fresh DVT. It was during one of these visits that the extent of the damage from my initial clot, as I had also had a second by that point, was found. With the first stage, you have fresh in your mind that your DVT or PE could have quite possibly killed you. Most patients, I am sure, are reminded of this on a regular basis by nurses and doctors over their care. So when all of a sudden you begin to feel tightness and pain in your leg again, the blue lights start flashing and off you go. You feel like a hypochondriac, and although people will often tell you that you are better safe than sorry, you can tell mostly that it's through gritted teeth, especially if it's the triage staff who you've probably seen for about the 4th time that month. And you also get to know them really well. One of them was actually on my Christmas card list. Over the first 2 years, my PTS symptoms were really bad. They had limits of my walking distance. The pain was causing issues at work, especially when I needed my crutches or needed to have my leg raised, and I was put on tramadol and eventually Oromorph as well for the pain. My vascular surgeon, Mr. Joseph, was fantastic. And after much persuasion from me, and believe me, there was a lot of persuasion, he agreed to do a venous bypass to alleviate the symptoms. I had this operation in October 2006, but by March 2007 it failed and clotted over. With the PTS still as bad, this caused me to reduce my hours in work and try to manage my symptoms. Over the coming months, I became engaged and my fiancé and I decided to have our first child. This decision was in part due to the fact that another bypass couldn't be performed if I was intending to have a child, as it would fail. By April 2008, I had given birth to our first child, Hannah, via caesarean section. The PTS by now was worse than ever. I had given up work on medical grounds and also had a child to look after. By this point, I also had a lot of collateral varicose veins across the top of my groin, which I've been told fortunately they've been untouched by the caesarean. And that was due to only excellent coordination between obstetrics and vascular at the time of the operation. My walking distance was nil on most days. I had been put on fentanyl patches to manage the pain and my leg was consistently 2 to 3 times bigger than my right. This was probably when I was at my lowest ebb, and God knows how my family dealt with it. However, I am a fighter and off I went again to see Mr. Joseph. 5 years on, and in the October of 2009, I had my second bypass, although this time extra measures such as a fistula between the vein and the artery and an award of a Flowtron intermittent pneumatic compression device for me to use at home. However, this still didn't stop it clotting over, and the operation failed 4 weeks on. I was told at this point that there was no other surgical technique to resolve this, and it would just be management of the symptoms. It was at this point I moved into what I call the second stage of PTS and VTA, where you slowly start to realise it's either sink or swim. The condition gets to a point where it controls your life, what you do, where you go, what your family do. And I also didn't really have time for the consistent A&E visits with a lively 1-year-old, so I had to make changes. So me being me, decided to make things a little bit easier and have another child, because there was no bypass to fail. I had been told it was damaged my leg, but let's face it, it was damaged anyway. And I gave birth to Luca, my youngest child, on the 30th of April 2013. The pregnancy was a nightmare, including having a PE on therapeutic fragment, hemorrhaging after the birth, and the temporary vena cava filter I had fitted impacted through the vena cava and hooked onto my diaphragm. This was the final turning point into the person that is standing here today, finally into acceptance and having an attitude of what will be, will be. Within the space of a year, I had had a few experiences that, should they have gone wrong, they could have easily resulted in death, but I was still here. I had a fantastic family, so however long I've got left, I need to enjoy it. I now live my life under a strict routine that gives me rest, but also allows me to be a mum. I no longer look upon the activities with, oh, I can't do that. I actively seek ways I can do it. I have accepted that I am never going to be able to run a marathon or be anywhere near as mobile I was when I was 25. But if there's something I want to do, I go for it and just deal with the pain afterwards. Currently, my leg is still on average 2 to 3 times as big as the other. My mobility is still quite poor and I am still fighting. Tomorrow I will see Stephen Black over the stent procedure to see if it can help me. And also straight after this talk I'm running off to Guy's for an ultrasound scan in preparation for that meeting. If it's a yes, great. If it's a no, I've lost nothing. I am a recently appointed trustee of Lifeblood. I am also doing some social media fundraising called Legs Out for Lifeblood. And I'm in control now, not the PTS or the VTA. I'm also currently sitting on the review of a NICE guideline as a topic-specific layperson in VTA. Although currently I'm on about 9 clots and counting, and I've now managed to clot on 3 anticoagulants, but that is just a whole different story. And again, we could be here all day. Before I finish, I would just like to remind everyone sitting here that although I have had fabulous care and possibly more done to help my symptoms than the majority of PTS patients have had, The worst part about PTS and VTA is dealing mentally with the restrictions that come with it. To me, this is the unseen side, but once it is addressed, managing both conditions becomes an awful lot easier. Unfortunately, most medical professions in this area either do not recognise it or do not address it, and a lot of the time it's probably because of other external factors and trying to cure or treat the physical problem in front of them. The lifeblood buddy system has recognised this, and maybe if it had been about 10 years ago, I might have made my emotional journey sooner. To finish, I would just like to thank my partner Mark and my mum and dad for putting up with me, my fabulous friends and lifeblood for giving me the opportunity to become a trustee and speak here today, and also my doctors, Mr. Joseph and Dr. Marlowe. To all my fellow PTS and VTE sufferers, don't give up, fight, question and challenge boundaries no matter who is holding them, and also just remember to have a laugh. The illness is depressing enough without sitting there feeling miserable about it. I often laugh at the size of my leg, and if you looked on my board for the Legs Out for Lifeblood, I have actually stuck a hair extension on it, drew a face, put a party hat on it, all for Legs Out for Lifeblood, which I'm hoping will bring a lighter side to PTS and help patients who are like me manage it with that little smile on their face. Thank you.
I've forgotten how I sign up for Legs Out for Lifeblood. Can you remind me? You can remind everybody what we have to do, just so everybody in the audience knows.
Legs Out for Lifeblood, you take a picture of your legs, post them on Facebook, Twitter. You can link in my Twitter name or my Facebook name, which is either #LegsOut4LB on Twitter, or on Facebook it's Legs Out for Lifeblood and it's the number 4. And then text CLOT70, £1 to 770. The money all goes to Lifeblood. You can also nominate your friends to do it. And just remember, no matter how embarrassed you are of your legs, if you've got one leg that's 2 to 3 times the size of the other, it's not half as embarrassing as having ones that aren't tanned, but are generally both the same size.
Any questions for Claire? No, you're very clear. That was wonderful, Claire. Thank you very much. And we're very proud to have you as a trustee in Lifeblood. Thank you very much.
Well, I'll see you later in the
See you later. Yeah.